Okay, so we're back, guys. So this is the second treatment. Julio's come back a second time. And the first time, so like I said, Julio was on the motorcycle. His foot got in front of the shifter, and the bike kept going, and it ruptured his Achilles tendon. So there's a big scar because they've replaced it. After our first treatment, there was a lot of pain that kind of went halfway up the calf. And so that's what we were treating at the start. Now the pain has localized a lot more to where the rupture was and where it's sort of like healing up onto the bone and a little bit higher up. So I've kind of moved my treatment down a little bit and I've focused on those areas. It has been a request that we don't use too many needles, so I want to keep that in a minimum kind of amount. When I did my distal needling here on the hand, you'll notice before I'd needled up a little higher up. Now I'm really focusing across the pisiform. I've kind of come underneath, I've come right tight to it on both sides, and I've touched the tendon a couple of times. The reason for this is I'm trying to mimic and mirror as the Achilles attaches to the calcaneus. So I've come a little bit distal on the wrist to mimic the pain distal down. And I've tried to touch structure for structure. I'm touching the bone and the tendon and trying to get into those same sort of places where you're getting the attachment of the tendon onto the bone. And again, that's because you're trying to touch like structure for like structure. Taking it really easy, but the pain's really changed. The other thing that I've asked Julio to do is we've kind of used like a concept of like perhaps a sort of common man's version of like gua sha technique, where I've got him to use like the backside of a butter knife and just do some gentle scraping up here to really stimulate the area. Really easy, nice way to break up some of that stagnation, get the scar tissue moving. I've added some electrics, running that across, and that's kind of the plan. So again, I've used like small intestine and heart to mimic aspects of kidney and bladder. And I've used the tendon attachment for the tendon attachment. So like structure for like structure, meridians that correlate, right? So I've got small intestine, which is the up-down pair of the bladder. I've got heart, which is the up-down pair of the kidney. Heart will treat bladder, bladder will treat kidney. Heart will treat bladder and kidney, and small intestine will treat bladder and kidney. And so I've just used these to help stimulate real quick, real easy, but that's something that you can kind of consider in clinic. It's a really nice way to treat. Generally, when I'm doing this, as like a quick note, when I needle the hand, I needle the hand first, right, or the distal area that I'm treating. I get them to move the area that's in pain so that I can chase that a little bit, and then afterwards I'll go local with some stuff like this. These are all super fun things that we're doing in Tropical Paradise here. Our clinic will be up and running in the next couple of months. We are doing internship programs to help do some service work to help lots of people. If you're interested in coming down and like getting a whole big bunch of treatments under your belt, building up your skills, doing some service work, and then running around the jungle and seeing some beautiful places, this would definitely be an option for you. So hope to see you down here.